Welcome to the final module of a three-module series about pharmacy harm reduction practices for Arizona pharmacists and pharmacy technicians. In the first module, we discussed the meaning of harm reduction and how principles of harm reduction are and can be expressed through pharmacy practice. In the second, we discussed bloodborne illnesses and skin and soft tissue infections to underscore the purpose and importance of harm reduction pharmacy services. Now, in this module, we will address state laws and policies governing harm reduction pharmacy practices so that pharmacy staff in Arizona have the awareness of how these services are supported in Arizona.
Have a nice day.
You too.
Hi, how can I help you?
Hey, I need to purchase some naloxone and some syringes.
Do you have a prescription by chance?
Prescriptions to fill today? No. I just need some naloxone and some 1 ml syringes.
I mean, do you have a prescription for the syringes or the naloxone?
Do I need one?
I think so. Let me ask the pharmacist. We don't dispense that much here, so I'm not really sure. One moment. Hey, do you have a minute?
What's up?
So this patient here wants to purchase naloxone and syringes without a prescription. Is that even legal here?
I believe so. Let's go to check.
Okay.
Hi there. Are you a patient here?
Well, I am right now. I've filled prescriptions here in the past. This is my go-to pharmacy, but does any of that matter?
Actually, I don't think we can legally dispense anything without a prescription. So we will have to say no to the syringes and naloxone today.
Okay then.
Sorry.
This module will tie up our loose ends so that we understand the legal and policy bases for harm reduction pharmacy practices and services. It will also give us a chance to practice some skills and through that, to increase our collective self-efficacy, to sell syringes without a prescription, and to engage in other harm reduction pharmacy practices that make sense for your pharmacy setting. Let's begin by seeing what we know and believe. This section is about laws and policy. In this course, we have discussed several harm reduction pharmacy practices. Let's take a moment to review important concepts and examples. Now, this is a shot of the infographic that you may download as you wish after this training. We will make these materials available to you. Let's take a moment to review. We've spoken about the first two of these harm reduction pharmacy practices throughout the training. The first is dispensing syringes without a prescription, and to do so, we hope, in a non-stigmatizing manner. The second is to dispense naloxone without a prescription. Now, we know layperson access to naloxone is important to prevent opioid overdose deaths, and this has been recommended by our former Surgeon General, Jerome Adams, and continues to be a recommendation at national and state levels. Pharmacies are important partners for providers of opioid use disorder medication, such as buprenorphine. Those prescribers rely on pharmacies to dispense opioid replacement therapy. But there is also consultation, which occurs as part of pharmacy scope of practice. And in this case, it's related to harm reduction behaviors that will help patients avoid health risks. Now, this includes PrEP, naloxone, and safe syringe use. And pharmacists, because they are trusted health professionals, consult with patients about a range of issues. These are opportunities to talk about pre-exposure prophylaxis for the prevention of HIV, safe syringe use, and naloxone use. Finally, pharmacies can provide referrals, a warm handoff, or even just a list of referral organizations that you saw in the vignettes. And they can do this with the help of local partners in the harm reduction communities or from local health departments. Now, our harm reduction research lab will provide these resources by county and area to pharmacies that are enrolled in our ASAP study. Each of these pharmacy practices, all 5 of them, are easy to implement and can help build support and interest in the community for pharmacy services. In fact, the sale of syringes or naloxone, or consultation about PrEP or HIV prevention, are pharmacy services with financial benefit for the pharmacy. That includes dispensing opioid replacement therapy. These pharmacy practices are not only recommended to improve population health, but they're also permitted under state law. Now let's take a look at these practices and their legality.
Let's now turn to specific pharmacy practices supported by law and policy. As of 2020, all 50 states and the District of Columbia had passed laws governing naloxone access. State laws tend to include the following elements, as described by the Legislative Analysis and Public Analysis Association, or LAPPA. First, standing order provisions. Second, persons who can prescribe, dispense, and/or administer naloxone. Third, immunity to persons who prescribe, dispense, or administer naloxone. Fourth, training and education requirements. Fifth, co-prescription requirements. Sixth, requirements placed on insurers. And finally, seventh, naloxone in schools. Naloxone dispensing through pharmacies across the country increases significantly following state enactment of standing orders. Standing orders allow patients to purchase or access naloxone without a prescription. This is important because increasing layperson access to naloxone will help reduce opioid overdose deaths in the community. Arizona's current standing order, shown here, allows Arizona licensed pharmacists to dispense an intranasal, intramuscular, or subcutaneous naloxone dose without a patient-provided prescription. The Centers for Disease Control and Prevention recommends that naloxone be dispensed whenever dispensing opioids. Arizona's standing order is renewed annually, and we do not expect this to change given national recommendations based on the current opioid overdose epidemic in the U.S.
Now let's turn our attention to counseling about pre-exposure prophylaxis for HIV, known as PrEP. So PrEP is a medicine that significantly reduces the odds of HIV acquisition. It, as you can see in the slide, is more than 90% effective when it's taken as prescribed relative to the sexual transmission of HIV. Again, looking at the slide, more than 70% effective relative to the transmission of HIV through shared injections or injection equipment. So some states have permitted PrEP dispensing without a prescription. As with other pharmacy-based harm reduction services, PrEP is part of the national program designed to end HIV by the year 2030. So, consulting about and dispensing PrEP is something that can improve individual and community health because it will help reduce the burden of HIV in communities where PrEP is taken as prescribed. State bills proposed and laws passed strive to increase access to PrEP by requiring insurance coverage of PrEP, prohibiting pre-authorization, prohibiting therapy in order to receive PrEP, and assure access for minors. Some states allow pharmacists to prescribe PrEP or to dispense it based on standing orders. In Colorado, for example, pharmacists can now prescribe and administer PrEP. California and Oregon also passed similar laws. In Arizona, retail pharmacists can counsel patients about using PrEP and help them access a health care provider who can then prescribe it. A recent study in Arizona and Indiana found that people who inject drugs did not think that PrEP is indicated for them. So, in Arizona, pharmacists have an opportunity to discuss PrEP with their patients who inject drugs in order to encourage them to consider this option. Also noteworthy is a national study that found state scope of practice laws where physicians have significant oversight of PAs and nurse practitioners have decreased PrEP prescribing. In Arizona, however, where nurse practitioners have full scope of practice, they prescribe over 40% of PrEP among new patients. This means that pharmacists can play an important role in Arizona relative to PrEP consultation and referral to PrEP providers who are nurse practitioners. So in this slide, it's important to remember that harm reduction is a larger concept, and PrEP for people who inject drugs is certainly part of that concept. So as a pharmacist, you have the ability to counsel and promote relative to PrEP. This is especially true for people who are filling prescriptions for perhaps an STI medication, or requesting to purchase syringes or naloxone, or requesting community services, such as being tested for HIV or hepatitis C, or even STIs.
Non-prescription syringe sales are one of only 2 ways that people in the United States can obtain sterile syringes without a prescription to prevent bloodborne illnesses through injection drug use. One way is through the regulation of syringe service programs, also known as needle exchanges. The other way, and the focus of this program, is pharmacy-based syringe sales. Pharmacy syringe sales are regulated on a state-by-state basis, and federal regulations also impact the need for pharmacies to fulfill this important role in the community. Even in states that allow syringe service programs, pharmacies are often more accessible because they exist in almost every community, have consistent and longer hours than many syringe service programs because SSPs are operated using grant funds and are therefore limited, are places people already use for other reasons, such as buying food or other sundries. There are a few categories of laws governing syringe sales in pharmacies. They include all actions related, such as dispensing, decisions to dispense, and possession of syringes once purchased. Criminalization or decriminalization of syringe possession. Arizona law was just changed in 2021 and will be discussed shortly. Decriminalization of syringe dispensing without a prescription. Conscience law. This refers to laws that allow the pharmacist's discretion based on their conscience. It may also be known as refusal law. Drug paraphernalia. All states have laws prohibiting the distribution of drug paraphernalia. These laws were developed in the 1970s, but have been changing recently to address the syndemic of opioid overdose, hepatitis C, and HIV. This involved exemption of syringes as drug paraphernalia to allow possession of sterile syringes. 8 states specifically exclude syringes, needles, hypodermic devices, or objects used for injection of drugs. Oregon, Nevada, Minnesota, Wisconsin, Illinois, Vermont, Massachusetts, and Maine. 29 states specifically identify syringes as drug paraphernalia. Another 16 states have legal exceptions allowing for distribution of syringes to prevent bloodborne infections. In the southwest region of the U.S., this currently includes California, New Mexico, Utah, and Colorado. 7 states specifically exclude pharmacy syringe sales from the law prohibiting syringe distribution: California, Virginia, Maryland, New Jersey, New York, and Maine. Arizona recently changed state law to exempt syringes from drug paraphernalia in the effort to reduce BBIs in the state. States have updated their laws since 2017 to respond to the epidemics of opioid overdose and bloodborne illnesses. As of 2019, 39 states, including the District of Columbia, had laws in effect that removed legal impediments to explicitly authorized or regulated syringe service programs. State laws have also changed to allow pharmacies to sell syringes. A review of studies focused on pharmacy syringe sales up to 2011 found that 8 states at the time prohibited pharmacy syringe sales. 22 states had laws that were unclear about it, and 22 states allow it. Thus, at this time, you, the pharmacist or pharmacy technician, have a newfound ability to greatly reduce the frequency of BBIs and SSTIs among a highly vulnerable population. Conscience laws. 6 states permit pharmacists to refuse dispensing anything, medications or devices, on religious or moral grounds. They include Arizona, Arkansas, Georgia, Idaho, Mississippi, and South Dakota. The law requires pharmacists be knowledgeable on the risks and benefits of what they're dispensing and how this can become a problem if they're not. A central example of this is the refusal to sell and dispense syringes at the pharmacy. Corporate policy. Corporate policy also plays a role in pharmacy harm reduction practices. These range in focus and have different impacts on patient health. Often, when state laws are silent, pharmacy policy provides additional guidance for pharmacists and technicians. As an example, one large pharmacy corporation issued a statement in 2017 indicating that syringes cannot be sold over the counter without a prescription if it is known that the syringes will be used to inject controlled substances. Another large pharmacy corporation determined that pharmacists could not refuse prescriptions on moral or religious grounds, essentially trumping conscience clauses when patients have a valid prescription. These policies harm people who inject drugs themselves and the community because when pharmacies refuse to sell syringes without a prescription on moral or religious grounds, they are not stopping injection drug use, but forcing the person to reuse or share syringes in order to stay well, or to stave off the withdrawal symptoms. Take a moment to identify pharmacy policies that might help or hinder your ability to deliver harm reduction pharmacy services. Are there verbal agreements to operate in particular ways that fall outside pharmacy policy? As of 2018, 317 syringe service programs were operating in 39 states and the District of Columbia. 5 states accounted for 46% of those SSPs: California with 43, New Mexico with 32, North Carolina with 24, New York 23, and Kentucky had 23. As non-medical prescription opioid users transition from pills to injection as a more efficient mode of administration, many urban and rural areas at risk of injection-driven disease outbreaks remain without syringe service programs, and outbreaks continue to occur in unserved communities. Plus, in many cases, syringe service programs cannot alone provide universal access to sterile syringes because they operate on limited grant funding and are therefore not located in every community and not open during all the access hours that are needed.
So let's take a closer look at Arizona laws to see what they say about harm reduction practices in pharmacies. Now, just to review, the key pharmacy harm reduction practices are PrEP dispensing and consultation, pharmacy-based syringe sales without a prescription, and naloxone dispensing. Now, there are 2 others that you're probably well aware of, and that's dispensing of opioid replacement therapy and providing community resources. Now, these are not necessarily addressed in law, for the exception of laws permitting the dispensing of buprenorphine for opioid use disorder. Now, this slide briefly shows you what the laws say about the 4 areas of harm reduction pharmacy practice. I'll tell you a little bit more Now, for pre-exposure prophylaxis, Arizona law allows minors to consent to sexually transmitted disease diagnosis and treatment, and to HIV testing without parental consent. What the law does not allow is access to pre-exposure prophylaxis without parental consent. Now, that does not mean that you as pharmacy staff cannot consult with minors about PrEP. It just cannot be dispensed to them without parental consent or prescribed without parental consent. So it's important to educate your patients, even though they may not be able to access it without their parents or guardians. Syringe possession. Arizona law allows the purchase of syringes over the counter without a prescription. This has been the case for many years. The law does not require a prescription to possess syringes anymore. That's a recent passage of the law. We've decriminalized syringe possession. This also means that the law specifically exempts syringe service programs or their participants from criminalizing their syringe possession under the paraphernalia law. It allows distribution of syringes without a prescription. So pharmacies are completely clear of any criminalization for their activity to reduce harm to their patients by dispensing syringes without a prescription. In terms of naloxone, we have a standing order in our state, and that law guarantees prescriber and dispenser immunity. It allows civil immunity for laypersons who administer and criminal and professional liability for first responders who administer naloxone. Naloxone should be prescribed also when an opioid is prescribed. So encouraging your patients who pick up their opioid replacement therapy to also pick up some naloxone might be an important thing to do. So in summary, the importance of access to sterile syringes for the prevention of bloodborne infections, access to naloxone for the prevention of overdose death, and access to pre-exposure prophylaxis for the prevention of HIV is reinforced by Arizona statute. The law allows the following. It allows pharmacies to dispense syringes without a prescription. It allows pharmacies to dispense naloxone under the statewide standing order. It allows pharmacies to consult with patients about PrEP for HIV prevention, including minors. And it allows pharmacies to refer their patients to community services for testing, treatment, and syringe service programs.
Being a harm reduction pharmacy means that pharmacy practices are non-stigmatizing for patients and they convey harm reduction principles. This training highlights 4 specific practices which, if implemented consistently, will help reduce opioid overdose death and bloodborne illnesses in Arizona. We have discussed several skills related to harm reduction pharmacy practice. The next few moments will provide an opportunity for you to try your hand with these skills. I will present a scenario and will ask you to select the response that is most aligned with harm reduction pharmacy practice. Okay, a patient approaches the pharmacy counter and asks to purchase syringes. Which of these responses exemplify harm reduction practice and good patient care?
Okay, so would you like a bag, a box, or an individual syringe?
A box, please. 1 ml size.
Yeah, not a problem. Do you have a prescription by chance?
No, I don't.
Okay, is there anything else I can do for you today? Do you need naloxone or a community referral?
No, thank you. Just the box is fine.
All right, just a moment. All right, here you go. Just let me know in the future if you need any type of community referral or naloxone.
Thank you.
I'm not really sure why someone would need them.
I need clean syringes to prevent hepatitis C.
I'm gonna go get the pharmacist. One sec.
Hi, the technician told me what you need. Do you have a prescription?
No.
Well, this pharmacy doesn't sell syringes without a prescription.
Which of these responses exemplify harm reduction practice and good patient care? The answer is the first video. Why? Because the pharmacy was providing patient-centered care within the confines of the law. Even if the pharmacy had a policy that staff could not change, as in perhaps the second video, their countenance with the patient was discernibly negative. Plus, after answering the question about whether syringes could be dispensed, there was no other inquiry about services needed by that patient, as there was in the first vignette. Think about yourself in this scenario. What would you do? All pharmacy staff can be educated about the importance of sterile syringes for bloodborne illness prevention and the fact that patients will request them. How pharmacy staff receive patient requests determines whether patients feel safe, can trust the pharmacy, and will seek further help to assure their health. Arizona-based studies indicate that when people feel stigmatized at the pharmacy, they will not seek services elsewhere, pharmacy or otherwise, because they believe all places will treat them badly. Okay, a patient approaches the pharmacy counter and asks to purchase naloxone. Which of these responses exemplify harm reduction practice and good patient care?
We have naloxone in stock. Do you have insurance?
No.
We have the generic available for $45.92. How's that? Sorry about that. We have naloxone in stock. Do you have insurance?
No, I don't.
We have the generic available for $45.92. How's that? Have you been trained to use naloxone?
Yes, me and my whole family have been trained.
That's great. Is this for you or a friend or family member?
It's for me.
Well, I'm really glad that we have it. Just so you know, you can go to this local community organization. Would you like any other community services, such as local syringe service program or for treatment services even?
Actually, I'm gonna go here next because the naloxone here is a little bit expensive.
I understand. It's just because we don't carry the state-subsidized naloxone, but there are several organizations that do in Arizona. Here's a list of resources, and you can always go to Sonoran Prevention Works on the website down here to find naloxone near you. They're really great, and they offer a ton of services.
Awesome, thank you.
I'm sorry we couldn't help you today with the naloxone, but I am really glad to share these resources with you. Take care of yourself, okay?
Thank you.
Which of these responses exemplify harm reduction practice and good patient care? The answer is the second video. Why? Generally, the same exchange occurred, except in the first video, as the patient decides not to purchase the naloxone, the technician thanks them for visiting the pharmacy. No referrals or resources are offered to the patient. No subsidized naloxone is offered because the pharmacy does not have it from the state. The good news is that even if we don't have resources to share in paper form with patients, we can all refer them to the Sonoran Prevention Works Find Naloxone link. All we need to remember is that people can go to the website for Sonoran Prevention Works and search for naloxone. The state funds this organization to provide subsidized naloxone throughout Arizona. Perhaps we can even arrange to have it in your pharmacies. That would work very well for your patients and your staff, as you will continue to reinforce the importance of community pharmacies in community health. In this case, in overdose death prevention. Okay, last one. Which is the harm reduction response?
Is your grandmother a patient here at this pharmacy? If so, what's her name?
No, I don't think so, but she does need syringes.
You know, it's okay if you're the one who needs the syringes. You actually don't need a prescription to buy them here in Arizona. We care about your grandma's health, but we also care about yours. I will sell you what you need. We also can help with other services such as naloxone or referrals to community organizations that provide syringes and tests for HIV and hepatitis C for free. Are you interested in any of these?
Yeah, I suppose it wouldn't hurt to know where I can go for treatment. Do you have a referral that I could have?
Absolutely. Here's a list of different treatment programs in the community.
Thanks a lot. I appreciate your understanding and the fact that you weren't stigmatizing.
Absolutely. Look, we're here to be a part of your healthcare team, and we want to help you the best way that we can. You have a great day, okay?
Thank you.
Mm-hmm.
Okay, is your grandmother a patient with this pharmacy? And if so, what's her name?
No, I don't think so, but she does need syringes.
Do you have a prescription?
No, but I can usually pick them up for her at other pharmacies without a problem.
Well, not here. We don't hand those out without prescriptions. I'm sure that there are some other programs out there that will give you syringes for drug users. Next.
That would be the first video. It should not matter what the syringes are for. They are over-the-counter purchases, and access to clean syringes reduces the spread of bloodborne illnesses and does not increase overdoses or illicit drug use. The impact of the decision not to dispense syringes is larger than individual pharmacy staff may know. It requires a lot of courage to walk into a pharmacy and ask to purchase something that society stigmatizes, such as syringes and their use with illicit drugs. Refusing to sell syringes does not improve community health and does not save anyone money. Refusal to sell syringes will not make the patient stop using drugs. Refusal will not encourage patients to seek help. Stigmatizing interactions at the pharmacy will discourage patients from seeking pharmacy services and health services in the future. But we also want you to pay attention to the level of service offered in each of the scenarios, whether harm reduction or not. Even if your pharmacy cannot or will not sell syringes, you can treat your patients with care and can use strategies as a pharmacy staff, what you could offer them in lieu of syringes. This is particularly important for staff who cannot change pharmacy policy.
This training is developed to help you consider being a harm reduction pharmacist or a harm reduction pharmacy technician. So what is a harm reduction pharmacist or pharmacy technician? A harm reduction pharmacist or pharmacy technician is a regular pharmacist or technician who has more behavioral healthcare tools at their disposal to help reduce harm to their patients when presented with the opportunity to do so. Pharmacy staff practice in pharmacy settings that may be part of a small pharmacy group, for example, less than 5 pharmacies, or part of a corporate or chain pharmacy setting. Each setting has 3 levels. At the individual level, you find yourself, the pharmacy staff member. Our life experiences, knowledge level, and attitudes often influence decisions to practice in a particular manner within our pharmacy. Sometimes, things we do as individuals within settings can be influenced by organizational level factors or social level factors. Turning to these social level factors, this refers to your working peers at the pharmacy. It may only involve people who work at the same time as you do on your shift, or it may include the entire pharmacy staff across work schedules. Sometimes social level influences are external to our work environment. Our friend or colleague group may influence what we do or decide to say in the pharmacy environment. Next, we have the organizational level. Organizations use rules and guidance to influence pharmacy practices, in the case of pharmacies. This may be corporate policy or advice from the pharmacy board. We've already discussed law and policy, but these levels, the individual, social, and organizational, matter just as much. Why is that? Because the rules, just like laws, help shape the context in which we make choices in our pharmacy practice. Sometimes we might even be engaged at the public policy level, as is common with the Arizona Pharmacy Association. In this training, we want you to make the choice to be a harm reduction pharmacist or pharmacy technician. This involves a commitment to the concept of harm reduction, a plan to engage in pharmacy practices that are grounded in harm reduction, and for you to champion these practices and the philosophy of harm reduction within the pharmacy environment. First, it is important to clarify what, for you specifically, may matter most in your decision to be a harm reduction pharmacy technician or pharmacist. Take a few minutes to think about where you and your pharmacy colleagues might be in regards to the ideas we have shared in these 3 modules. If you yourself are not supportive of these ideas, but you are in a pharmacy that would likely support the ideas and embrace, or are currently embracing now, harm reduction pharmacy practices, ask yourself, what would I need to learn or think about that might help me choose to become a harm reduction pharmacist or pharmacy technician? If you are supportive, but your pharmacy colleagues may not be, ask yourself, how could I help my colleagues understand these concepts? If the training is helpful, refer them to this training. At least they will earn credit for its completion. If you are supportive and your pharmacy is too, identify what you need to support the pharmacy practices. Is it, for example, having access to state-subsidized naloxone for dispensing to patients who can't afford it? Is it having a locally curated list of community resources in BBI screening, treatment, substance use order treatment, harm reduction supplies, PrEP prescribing? All of these situations are manageable within our pharmacies and our pharmacy working context. Becoming a harm reduction pharmacy would really improve the health of Arizonans. This fall, we will be implementing ASAP as an intervention in pharmacies located in Pima, Maricopa, and Mojave counties.
To help pharmacies become more harm reduction oriented, we are building a pharmacy practice intervention called ASAP, which stands for Access to Syringes at Pharmacies. Now, ASAP involves a professionally accredited online on-demand training for pharmacy technicians and pharmacists. You're completing that right now. It also includes intervention materials for patient referrals, and these referrals are curated to your area, and safe syringe disposal kits, as well as a tracking process for syringe sales. To explain further, ASAP involves this accredited online on-demand training, which you're completing right now. What else do ASAP pharmacies do? Well, because we are building an intervention in collaboration with pharmacies, and we want to make sure that it works well and is realistic, ASAP will also involve checking in with pharmacy staff about the implementation of harm reduction pharmacy services. Now, to do this, staff will complete very brief surveys, only a few of them, throughout the intervention period. They will be given a monetary incentive when completing all the surveys, and their responses will help us learn much more about implementation challenges and successes. Essentially, it will teach us all how to build an effective pharmacy-based intervention for statewide and even national scale-up. Our team will curate local resources for you and provide them to you, along with safe syringe disposal kits, which you can dispense as you dispense syringes without a prescription. So when patients come to you without a prescription and request to purchase syringes, well, they're going to likely be part of that ASAP effort, and you can dispense our provided syringe disposal kits with the ASAP logo along with it. This will help us all be assured that syringes are safely disposed. Our research team will also support each ASAP pharmacy based on the decisions they make to offer particular harm reduction services. And this is why we have asked you throughout this training to think about your comfort level with different pharmacy practices and your own pharmacy practice environments. We thank you for choosing to learn how you can implement harm reduction services in your community. Please take the quick test or quiz at the end of this training, and you will receive guidance about how to receive your CE credits. We thank you for choosing to learn how you can implement harm reduction services. For more information, you can contact me, Dr. Beth Meyerson, at the University of Arizona.